In this video I want to show how to register a patient, code a patient, and create an annual recall for a patient with diabetes in HealthOne. I will select a patient in this test database called blood pressure test who does not have a previous diagnosis of diabetes. This patient presents today and has been diagnosed with diabetes. I create a register for this patient by adding his diagnosis in his summary page, which is here, under either of these terms, medical history or problem. We suggest that for important diagnosis you use the item problem. If you type in here problem, click on that, and you will open up a box called problem. If I select the full dictionary here and type in diabetes, all possible diabetes terms from our dictionary will appear here. This is a type 2 diabetic, and in HealthOne by convention we use this term here for our type 2 diabetics. Diabetes mellitus type 2 NIDD. I will add this to the patient's problems, and you'll see it has populated the box here. In addition, it has automatically coded the patient with the appropriate ICD-10 and ICPC terms down here. I'll then say OK. This patient now has a register of diabetes mellitus in type 2 diabetes mellitus in HealthOne. This item allows us to search for our type 2 diabetics and do recalls, etc. But it also appears in all our referral letters, so there is no need to separately add the terms to a register. Just add them to the medical history page. I now want to create an annual recall for this patient. As this patient has presented today with a new diagnosis of diabetes, and I am very busy, I don't have time to do his full checkup, but I will get his bloods done today with the nurse, and I will create an appointment for him to come back to have his full checkup. I create a planning transaction here, and into that planning transaction I put a plan for a diabetic annual review. Again, in the full HealthOne dictionary I will search for a term called diabetic annual follow-up, which I use for this purpose, and I will give that plan a recall date by clicking on action plan here and plan date, and in this case I'm going to give a plan date of a week ago to make sure that I do not forget about this patient. So I'll give it a month ago to be absolutely certain, and I will give this a frequency for every future recall of 1 year. So I've given an early date so that I can demonstrate what happens if this patient is late for their appointment. So this patient now has a planned date for their first review of the 1st of May this year, and a frequency of every year for 10 years. And I say OK to that. And this little icon here shows that this is an action plan with a recall date. If I click on this patient's action plans, I can see all action plans for this patient, and I will be able to see here that this patient is a diabetic annual review recall for that date. If I close this patient down and save it, I can then look at in my selector, my patient selector, all action plans for all patients. And you will see in here this is all action plans for all patients. But I can filter this so that I only see those who have diabetes related plans, and I can further filter it for those which are overdue. So now I can see that I have 3 patients who are overdue for reviews. I can, if I so wish, do a mail merge on this group of patients, and if I had an appropriate letter, such as a diabetes recall letter, I could use that.